Work meeting and will be here as soon as he can. So Vice Chair Watts will take over the tickets. All right. You are live.
Ready? Right, good afternoon. Welcome to Children's Services Council of Leon County. This is our Governing Council Workshop, Wednesday, November 12th, 2025. And we're officially starting here at 3:06 p.m. This is a workshop, so it's not a public meeting, so we will not have public comment. But if you will, we'll go ahead and call to order. If you could call roll.
Ms. Richards. Here. Mr. O'Brien.
Here.
Mr. Johnson.
Here.
Judge Hobbs. Superintendent Hannah. Commissioner Cummings.
Here.
Treasurer Mitchell.
Here.
Vice Chair Watts.
Here.
Chair Jones.
Right, we have a quorum, so we appreciate everyone's attendance here. If you will, we're gonna dive right into our agenda, and next will be program.
Yes, thank you, Vice Chair Watts. So today's workshop, we will have two presentations, one presentation, and then of course, questions from the council afterward. And then the second presentation, and again, any questions or discussion from the council afterwards. Let me remind our viewing audience, this is not a governing council meeting, so there will not be any public comment or any votes taken at this meeting. So with that, our first presentation is from Capital Area Healthy Start Coalition for the COAST program. Just to remind the council, you approved an investment of $2.8 million in perinatal navigator programming through September 30 of 2026. We now have Chris Gorsick, who is the executive director of the Capital Area Healthy Start, here to present their data and their accomplishments and outcomes since inception. Chris, you have the floor.
Thank you. Like Ms. Pico said, I am Chris Gorsick. I'm the executive director of Capital Area Healthy Start, and I just want to thank you all for allowing me the opportunity to come and present to you the work that we have done since really August of last year when you all funded this expansion. So I wanted to just circle back to why we care about prenatal care and when it comes to kindergarten readiness. So prenatal care is crucial for kindergarten readiness, as the early development supported by proper prenatal care lays the foundation for a child's cognitive, social, emotional, and physical well-being. Poor health during pregnancy can lead to premature birth, which is associated with a higher risk for poor school readiness and skills like reading and math. Adequate prenatal care minimizes these risks, ensuring a healthier start to a child's life and improving their ability to meet the demands of kindergarten, which include the academic skills, the social emotional skills, and of course, self-care. So in Leon County, what does that look like? In 2024, 71% of our women received what's called adequate prenatal care. This means 29% of our population did not. When you don't receive adequate prenatal care, you have untreated maternal morbidities, which leads to preterm birth, low birth weight, and potentially even infant mortality. So in an effort to increase the number of women who are receiving adequate care, we developed Coast Through Pregnancy, which was part of the maternity telehealth project funded by the Florida Department of Health to serve perinatal women through pregnancy through 1 year postpartum who are at risk for adverse birth outcomes and prenatal complications, including hypertension, obesity, diabetes, and of course, mental health concerns. Our acronym COAST stands for Community Outreach and Support Team. Our pilot consisted of 2 perinatal navigators who supported a total of 222 women. As a result of the education, screening, resources, and health monitoring that we provided, 93 women who experienced escalated risk, life-threatening risk like maternal morbidity, mortality, received timely intervention and care. Additionally, there were 6 women who reported suicidal ideation with the intent to act that we were able to save. So COAST was actually developed in partnership with our birthing hospitals, our federally qualified health centers, the county health department, mental health professionals, doulas, and other social organizations that are social service organizations that serve perinatal women. Individuals from these organizations serve on our advisory board, and they contributed to the framework of what our program is today. That includes a systemic program consent, comprehensive intake forms that are inclusive of both medical and mental health questionnaires, and social drivers of health. This group still meets, we meet bi-weekly, and we do what we call community health rounds, in which our navigators present 6 to 8 cases of our most at-risk women. Board provides information on the care that they have received, women have received through their practice, whether that's one of the hospitals, the prenatal clinics, etc. We identify gaps and barriers, things that are missing for these families, for these moms, and then we work together to create innovative solutions to address these challenges. This interdisciplinary approach ensures that we effectively meet the client's needs and provide holistic, comprehensive care. It also has allowed us to create systemic changes to Leon County for our women. We are fortunate at the coalition to be the visionary and the conduit for the Navigator program, but this is not a Healthy Start program. This is a community program, one that is a collaboration across sectors to support. So the role of the navigators, they complete a comprehensive intake. They screen for mental health concerns. They screen for other factors that may impact health. They provide closed loop referrals to community partners who can assist the client with their needs. That could include anything from transportation and food, education resources, housing, mental health, and then also our home visiting programs. Additionally, the navigators provide ongoing condition monitoring. They provide medical devices such as blood pressure cuffs, glucometers, scales. They teach the woman how to utilize these sources, these devices, and how to track their measures, and when it is important to contact their provider. They provide health education and then trimester-based incentives as well. So our pilot was funded for 153 women in Leon County. In 2024, I want to just give you some numbers. In 2024, there were roughly 2,700 births for Leon County. 14% of the women suffer from severe maternal morbidity in 2024. So that's about 383 women. 12% of our infants were born at low birth weight. That's another 328. And then 11% were born preterm. On top of that, 1 in 5 women suffer from perinatal mood and anxiety disorders. And if you take that number into account, that's about 547. So we were only funded for 153. There's no way we could adequately serve our population. We also knew through our work with our hospitals, when we placed a Connect Family Partner directly into the system of care at the hospital, we were able to increase the number of women that we were able to connect with and get referred to services. We went from 20% to 85% just by placing somebody directly at the hospital. August of 2024, CSC Leon provided funding to expand our perinatal navigator program to the prenatal clinics, embedding navigators into the system of care. So that was August. and September. We hired and trained 10 perinatal navigators. We put them through what we call boot camp. We had organizations come in and train about what their resources were. We did motivational interviewing training, just all of the things 201 came in. We did a comprehensive training. In November, we placed our first navigators in OB offices. We put navigators at North Florida Women's Care, Gynecology and Obstetrics, Neighborhood Medical, and Bond Community Health. In January, we placed navigators at TMH Family Practice Residency, and in February, we placed navigators at Diana Health. Fast forward to September, we recently placed navigators at Dr. Nova's office. So we are currently in 7 of the 9 prenatal offices right now in Leon County. Due to the success and what we're doing here, what we've created here in Leon County, we were actually funded to expand coast. We recently, as of 2 weeks ago, expanded to an additional 12 counties, including Holmes, Bay, Calhoun, Franklin, Gulf, Gadsden, Jackson, Jefferson, Liberty, Madison, Taylor, Washington, in addition to our Leon and McCullough County. And I say those counties, I don't know if what comes to mind for me is those are prenatal care networks. There are no, very little OB care in those communities. So by placing navigators to assist in those communities, we'll be able to help them as well. We will be providing more navigators at Tallahassee Memorial Healthcare, including placing a navigator directly in the labor and delivery emergency department. With the additional funding, we also hope to identify and train licensed therapists in the specialization of perinatal mood and anxiety disorders in an effort to increase the number of women who are able to receive those specialized mental health services. We recently had our annual meeting and we had a panel of clients, and the clients all spoke about the mental health services that they had been able to receive through our COAST program, our original pilot, and how the decrease in our funding initially affected their ability for that continuum of care, and how that played a role in their health and well-being and their ability to care for their children. We also, so with that funding, we'll be able to go back to providing one-on-one therapy sessions for women, not only in these expanded counties, but I'm going to use some of this funding to support our Leon County women as well, to provide those individual services. And then our lower risk moms who still need that assistance will be able to do group therapy sessions with. We're also hoping to increase the number of women who are served at through Sound Beginnings, that program, who connect with doula services, and then also have access to early literacy programs. And the hope is to expand our Littles to Leaders early literacy program into the prenatal space. So with the funding from CSC Leon during the time period of July 1 of last year through September 30, we provided 1,953 initial intakes. During that time, that was Leon and Wakulla County. We right now have about 30 Wakulla families, so the rest of that number is all Leon County. Of that 1953, 1,058 of these women were referred to home visiting services, 400 to doula support, and another 141 for mental health services. Our contract measure says that we will connect high-risk women to at least 50% of our high-risk women to additional intensive service providers. We hit 82% this year. We are contracted to serve 900 women over a 2-year period. That 735 that is on the screen is only Leon County. We've served and are serving, well, through September, 735. I think our number is closer to 800 for Leon County currently. And then in partnership with 211 Big Bend, our perinatal navigators have scheduled approximately 1,200 lift rides for our moms. budget. Our revenue last year from CSC Leon was about 0.29 million. Our expenses were about at 804,000, leaving a net of 488,000. The numbers on the previous slide, I need to increase our navigators, even the ones just serving Leon County only. I've got caseloads of 180 plus for our navigators right now because the need is so intense in our community. But even with increasing the staffing, we're hiring again right now, even increasing staffing will still be at or below budget this next fiscal year. I also have a 25% match to the funding that is provided through CSC Leon. Help serve not only the mental health, but also the piece. Questions?
So what we'll do is, first of all, thank you for the presentation. We will possibly review our cards and then I'll recognize you. If I get to go first, so I'm vice chair. You are? Hey, you're right, the chair. So I'm a big fan of Chris, you know, it's just, and I was reading the report and I just want to share with, you know, this group, you know, you have a force, a community force. Anytime I've participated in any of your team calls, you know, and just the education, I never even knew what a doula was until I met you. And I was like, asked 1,000 questions on one of the calls because I firmly believe in the doula process. So here's what I'll say, short version. Some of your reporting had information where you teams intervene with domestic violence. Your teams intervene with, you mentioned the suicide and the mental health, and various other things. Your navigators, are they one touch or there's several? Do they continue to work with those families? And is it the model is to have that same navigator with that family, or are they spread?
Good question. So the model is that the family, the mom stays with that one navigator because there is a relationship that is built and a trust that is built. It is not a one touch. We do the initial intake and then we follow that mom throughout her entire pregnancy, 1 year postpartum. That is, it could be different things. The navigators are at the offices. So when mom comes to her appointment, they can discuss and meet with the navigator, but at the same time, this also allows for a telehealth model. And so in some cases, there's telehealth in between those in-person appointments, just depending on mom's needs, et cetera.
So last comment, you mentioned the word relationship, which I was gonna bring up. And you know, I was so motivated to vote for funding you all is because it is bigger than the prenatal. That relationship piece goes a long ways. You talk about the doulas, X, Y, and Z. People have the ability to relate to people that are like them. In some instances, carries and crosses multiple factors. And so where that prenatal may have touched that mom at birth, if it was successful, or, you know, there was something else successful there, when that child is 5 years old and maybe that family is going through something, they're going to likely have that relationship established with those folks that they came in contact with here, that, you know, they will rely on to continue to produce better outcomes. So I'm a big fan of it, just to show the council it has the potential to everything that we think that we want the Children's Services Council to do. It is a great bang and for your buck in return because it has potential across so many different pockets. I just wanted to share that. That's all.
Thank you. I was just gonna add, that is exactly what's happening. I've got doulas that are being contacted when the child is 4. And they're reaching back out and saying, hey, I need help getting into BBK, or I need help with XYZ. And the doulas are that confident. They're just part of the post program, right? We don't have enough data yet on the navigators because we're just over a year old, but I see that same scenario happening. There's really close relationships that are being developed. navigators are sitting in on the OB appointments, making sure the mom understands what the provider is saying, and then helping her navigate our system, which right now is difficult, especially when we have one maternal fetal medicine provider practicing right now.
I think, I can't remember, Mr. Mitchell or Mr. Brent? Mitchell. Okay.
I learned from your questions. I'll thank you better. I just wanted to make sure I understood where your intake point is for contact with clients. And look, is it just in the BGYN or labor and delivery in the hospital room? Hospital and delivery at the hospitals, or are you reaching out into the community to see people that are not receiving any prenatal care?
Yes, all of these.
All of the above.
So the goal of putting somebody directly at the prenatal provider office is to reduce stigma, right? Because it's just part of our system of care, and the same with the hospital. But I have an outreach team that goes out into the community. We search for those women who are not receiving care and try to get them wrapped into services. We've also created special relationships with community partners who, if they have a woman who comes to them and has not received care, they automatically get a referral into CRUS. So once again, trusting that community member to get them referred to services. And if I have somebody that I trust saying it's okay to go talk to the navigators, likely than not, they're going to enroll.
Do you have any idea of what percentage of the clients that you're touching are coming through your community outreach and identification versus those that are showing up themselves in the OBGYN or labor and delivery environments?
I didn't bring my annual report, but I think last year we had over 4,000 referrals into our Connect program, which is that
Okay.
first stop.
And then my last point, usually until the next one, is I'm trying to understand if there's a natural handoff point. I know Vice Chair Watts mentioned that there's potential long-term contact there, longer term than just the birth of the child. But is there a handoff into any of the other programs that we've got, and how are we managing that?
So if I may, Vice Chair, yes, so all of our programs are interconnected. So, for example, the FRCs are very aware of the hearing aid program, the COAST program. So if they come in contact with a mother, a family where there is an expected mom, as they're doing that, I was gonna say screening, but as that intake, and they find out this mom has not had natal care or looks like they need support, they refer them. So all of it's kind of interconnected.
Thank you.
Yeah, Chris, I too, huge fan. I think work you guys are doing is phenomenal. It fits there are a lot of really good programs out there, right? That I could support. They don't all fit into one of these categories out there that we as a council have decided this is where we're going to put this limited amount of money that we receive. And I think this does. And I know you said that you haven't been able to collect, loads of data because it's still new. But I am hopeful that as the data is being collected and as we continue to spend money on what I think is an incredible program, that the results are going to be that the mom who was pregnant and receiving prenatal vitamins and coaching and nutrition will give birth to a healthy baby boy or baby girl. That baby boy or baby girl, 4 years from now, 5 years from now, will be entering a VPK program or kindergarten, ready to learn, and then we can follow those kids. So I think data is incredibly important, and it will tell us intuitively, this is good and it's right, but it'll tell us, are we getting the desired result? as it relates to, and the only thing I'm a little confused by is the numbers of people that you come in contact with as a direct result of our funding. It's sort of like our funding puts you in the community, so you have more connections, I guess, with expecting mothers, and then is it a year later? Is that?
Up to a year.
Okay. The zip codes and the demographics of the people that you're coming in contact with, are you documenting that? I mean, no personal identifying, okay. Does that match? I know it matches our goals, but does it match the goal of the zip codes that we are aiming for?
It does, but we're also serving all zip codes.
Right,
Yes,
But-
it does.
okay. From this may not be a fair question to ask while you're standing at a podium without access to all the data, but percentage-wise, the zip codes, are you mostly serving 32304, 32301,
Three,
and
05.
1005? Okay.
Yeah, and they're actually 5 zip codes.
I don't want to speak
Okay.
on that, but I can get back to you. I can tell you that the number of clients at Bond and Neighborhood, huge. I've got, I think, my navigator at Neighborhood Bond has about 180 on her high school.
I will say that, again, program amazing. It checks every single box for me. We as a council decided there were priorities that we wanted to fund, and there is no doubt that yours falls into that. Same time, we wanted to serve a portion of the population that there were gaps in services and needs that were greater than other parts. Doesn't mean we can't serve people in 32312. In fact, I think we should be. But our focus should remain what we started as, and that is there are zip codes that have the greatest amount of needs. And so I'm anxious to see this data be collected and the results of the data. And I, like the vice chair, appreciate so much what you guys are doing. So thank you.
Mr. Vice Chair, if I may, because I see our elf over here. I saw the circle graph that she pulled up. So this program, along with all of our others, uses our services and activities management information system and has to collect that data. So I'm looking at Holly over here and I saw a circle graph. She may have some preliminary data on zip codes that have been served from the information that we have received thus far. Now, it may not be totally up to date only because she's pulling it from what we have. so
Totally
far.
good. Okay.
So that gives you the look-see, and I don't know.
That looks like a lot.
So I can tell you in 01, 16%, 03, 19%, 04, 43%.
So 20%.
20%.
It's 20.
Oh, I'm sorry, 20.43. Look, I'm looking like I did. 05, 10.5. So the biggest service areas are, yes, 01, 03, 04, and 05.
And then for 32310, it's 8.77.
If I,
All right, hitting our targets.
yes, but
At
I,
least preliminarily, that based on this data.
I do also want to remind the council though that we have moms who might be couch surfing 32312 or 32317, right? They don't have a home, but they've got a friend and that's where they're staying. So just to put that in perspective for you as well, but
Oh, thank you.
All right, I think Mr. O'Brien, did you miss Ally or?
Oh,
Wait. Mine's more logistical. I see what's going on here. This has literally a tremendous benefit to all of us involved. I don't think I see you're connecting with the providers that deliver babies, that engage in the care of others. Preborn children. There are about 5,000 births in our community every year. Question is, how do you identify which of those? Because you don't do all 5,000. You have to prioritize, you have to identify which ones are the ones you're going to bring into the program. How do you screen those out? I mean, I know there's zip codes, everything else, but not every mother has the same number types of needs population.
So
We're looking for the higher risk populations here, right?
we are, but sometimes that first time mom who has a specific and master's degree is just as high risk.
No, that's a risk. I mean, the first child is always kind of
Yeah.
business.
So I would like to touch 100% of our panels. I'll figure out how to do that, but that also involves us getting into the community more. Getting in front of them at the prenatal clinics and at the hospitals was a huge first step for us, right? Because there's so much, I don't know, the stigma associated with it, and just, hey, if I go talk to them, DCF is gonna get involved. But but you hear that too, correct, right? And so we're trying to remove that, DCF involvement is not a bad thing. And so honestly, it's still a voluntary program. Moms have to opt into it. But I would love for every single mom to talk to a navigator, find out what they can education wise.
So walk me through that. So say a patient goes to Dr. Gustav and says, you're now pregnant. How does this opportunity to volunteer, to engage, get presented to that patient? Because I'm just curious about other just.
That's it. So we have, every prenatal office is a different system of care. So it depends on what works best for those staff. So my leads are handling right now 7 different systems of care. They need to know every single system plus the hospital system. So at Dr. Portoffel's office, it would be, they come into the front desk, they check in. The front desk offers them the prenatal or the perinatal navigator, and they meet with them right there in the clinic. They do that intake, they do the screen, etc. And then if mom decides whether or not she wants to enroll. At Florida Women's Care, by placing navigators there, we actually increased the capacity of the providers because we're doing all of that on the front end. Telehealth. When mom says she needs to come in for confirmation of pregnancy, they get a 30-minute telehealth appointment with a navigator first. The navigators are doing a lot of that medical history on behalf of the provider office. So now the provider can increase the number of women they're able to see. And if the woman decides that in there, she wants to opt in or not. Now, if she says no during that first appointment, that's not the end of it for her. If something changes, the provider office is the back end to the navigator program.
In a changing world of technology, one of the things that might be an opportunity is some practices are linked into our EHR Epic, which they have MyChart.
Yeah.
And so much gets done on this these days.
Yes.
A lot of that can be pushed out to them on their MyChart accounts, where they get it on their phone, they have time to evaluate it, think about it, and engage that way. And so we talked about how to bring MyChart into the conversation.
I'm working with Jennifer.
Okay. All right.
That's right.
That's nice.
Thank you for that. Yeah, we're having a conversation about what that would look like.
Thank you.
Can you go back to the PowerPoint and go to the previous slide? I just want to see the previous slide. Also, I love how excited Vice Chair Watts got about this. That was so fun to see.
This one?
Yep, that's it.
Budget?
Yep.
Oh, I'm sorry. I thought she was sleeping. That's the question.
Thank you, Mr. Vice Chair. I certainly appreciate the presentation. I was one of the proponents of this, and I think we all had great expectations for clearly the perinatal navigators. As I think your presentation demonstrated that, but I just have a couple of questions, about the statistics. I appreciate Holly giving us a snapshot of the areas that we believe, of what that we know that you all have served. But looking at the statistic, I'm just trying to understand how that was arrived at. Are these numbers all the result of the contract that you all have with Children's Services Council, or what numbers were aggregated to generate the percentage? Is it all these numbers here on the statistic, or any one particular area?
Question. So, the coast program, these numbers are specific for,
Okay, can you speak just a little bit?
sorry, the coast program, these numbers here are specific for coast.
So the entire program?
Leon and McCullough,
Oh, Leon and all of these are Leon and Wacola.
but I have 30 women from Wakulla currently in the program. This 735 that are receiving ongoing care, that number as of September 30th was only Leon.
Okay, so the statistics and the percentages of zip codes that are being served are just based on this 735. Is that correct?
Yes, ma'am.
Okay, so your entire organization generates these other statistics for Wakulla in conjunction with Leon, but not necessarily the Children's Services Council contract.
No, ma'am. No, I have additional funding to support the families that are outside of Leon County. At the same time, I was funded for 900 clients over 2 years. I have to match. I had to find a match to help support this program. So the council, regardless of whether or not the mom is in Leon County, is paying for 75% of that mom's care. I'm getting additional funding to support the remaining 25%.
Okay, I appreciate that. So
Did I answer your question?
I think you have, but let me just double back. So from the contract with the Children's Services Council, definitively, you have served 735 women in Leon County. 735 this last year.
Through September 30.
Okay, awesome. And this report is pretty much the annual report then, I guess, from last year up until September 30th.
Yes, now I did use July 1 numbers because I had the numbers for my fiscal year, which is July 1 to June 30. And then added in this first quarter, our fiscal year, which is the last quarter of your all's fiscal year. Clear as mud, I understand, but that's how I got the numbers.
Okay, and then I understand from our executive director that we do have a measurement tool to determine the impact of the program on the women that you are serving in Leon County,
Yes, ma'am.
aside from women that you're serving in Wacolla.
Yes, ma'am. Yeah, the two, we're keeping them separate.
Awesome. Well, thank you so much. We appreciate all that you all do.
Thank
Mr. Johnson.
Yeah, just a follow-up question. Thank you, Mr. Vice Chair. So I'm trying to think through on the intake process. In that intake process, is there any inquiry from the patient or client about whether they are Medicaid eligible and whether or not any services for pre or perinatal care are or should be being provided through that Medicaid managed care entity?
Yes, 100%.
So you took my 5 sentences and answered it in one.
I did. Yeah, that's part of our intake is we ask about insurance because I have DOH dollars to help support the non-Medicaid clients as well.
Yeah.
This is not part of the DOH model necessarily, right? This is expanded wraparound services. Medicaid, if a mom does not have Medicaid or no insurance, if she has not completed an application at that first prenatal provider, when she goes for that first prenatal provider, Medicaid won't pay for it. They only go back to the application.
Do those managing, Medicaid managed care entities provide the actual navigation services as well as what you provide?
No, not to this extent.
And then my follow-on question, because there's some behavioral and mental health services along with what you're providing, is there any coordination with you and the managing entity for behavioral health services in Leon County, Northwest Florida Health, I believe?
Northwest Florida Health, I've been working on that. I'm not there yet, but yes, I've been working on that. And I'm also working on a partnership with, Jay Reeve.
Okay.
Appalachia, at Appalachia.
Yeah. Where? Thank you.
Ms. Richards.
When are they considered no longer your client?
Baby's first birthday.
Okay. And then I know that Director Green said that we're making the connection with a woman who comes in, they're at the FRC and they're pregnant and they send them to you. What about the connection after that first birthday? Are we doing it vice versa as well? So we're almost like passing them on to.
So our goal is actually to get a woman into more intensive services while she's pregnant. And so that means home visiting, and home visiting follows her up to baby's third birthday.
Okay.
If it's healthy family or a healthy start, and healthy families goes to 5. So the goal is that they have their home visitor through their home visiting program. They have their doula support. They have mental health if they need it. They have medical, and they have their navigator to be that glue that ties all of those things together and help them navigate. And because that model is how we set this up, if a home visitor loses track of mom, but the navigator has it, they're communicating and getting mom back engaged. And the same with the medical providers. The navigators are getting them back engaged with their medical providers.
Great.
Any other questions or comments? Okay, well, thank you very much.
Yeah. Post the PowerPoint to our website as is our practice, but we can also email it out to you if you would like to receive it.
Please. All right. Next, we're gonna have a presentation. This is a resource center expansion.
Yes, so prior to us having representatives from Children's Home Society of Florida come and talk about the methodology for determining whether an expansion will happen and the outreach process, I thought it would be in the we sense of the word, as in the whole CSC team. Thought it would be helpful to walk the council as well as anyone viewing through the process of determining an investment for an FRC, just as a reminder. So this is what you're seeing on the screen, and you also have it in your packet. So the very first thing is to determine the needs, which we've done. We use census level data to do that, and that is how we came up with the areas in Leon County on which to focus. So Fort Braden, Griffin Heights, Frenchtown, Macon Community, if you remember, we decided to do a pilot site here at Cross Creek. And so our Cross Creek site is here as well. It does sit though in between areas of need. The second part of that is mapping the assets. So in those communities, looking at what assets already exist, what partners already exist, looking at the neighborhood strengths, and beginning to gather those early readiness indicators. The third piece is prioritizing requested services. So that is where the residents are engaged to identify which supports the family's desire, want, need, and then the feasibility of having the capacity to bring those there. The fourth step is to establish a coordinated neighborhood leadership. So you use that readiness data to formalize a resident leadership structure, align all of the partners, and confirm the collective capacity to act. Then we come back to 5, which is strengthen the provider connection. So we coordinate service providers. We look at anchor institutions and ensure that there's alignment and accessible supports. The 6th step is identifying and prioritizing high access sites. And that's where we look at and evaluate trusted, visible, and centrally located spaces in a specific neighborhood that are suitable for service delivery. The 7th step would be some sort of recommendation for investment. So that would be presenting investment options, but those options are grounded in the readiness, the leadership, and the feasibility to support an FRC in whatever iteration it is, or it could be that maybe it's not time for that. I want to emphasize that. That's what this is talking about when we talk about a recommendation for investment. And then we evaluate the investment. So we review the options against the available funding, projected operational costs, long-term sustainability. Let me emphasize long-term sustainability, because while we would love to be able to fund everything and anything, we can't do that. And even with our FRCs, we know that they are working on sustainability. And this is to ensure fiscal alignment and strategic balance across the neighborhood. So we thought that it was important to gently remind our council that this is the process that has been used and that is being used as we look at FRCs in our community. And with that, I will turn it over, I believe, to Tiffany Martin, who is the Executive Director of Children's Home Society of Florida here in Tallahassee. She is going to walk us through the readiness plan for Griffin Heights, Frenchtown, and Macon. And then we'll open it up for any questions, discussion. Council members, this is the time to ask those questions, to really look at this plan that they've put together, so that when we leave here, we are all on the same page with how things will move forward with this process.
Thank you, Director Green. And before we have a Children's Home Society, I just want to open up, did we have any council member comments on, I want to just, go ahead.
Can I ask a question?
Sure.
What you just walked through, is that part, did you lift that directly from the national model? Is this part of the national model?
This is how it all unfolds.
Right.
This is what was used in Fort Brady. And believe it or not, it was used here at a little bit of a smaller scale, only because the approval was already here for the FRC with a pilot. But this is how the process unfolds.
This is how the process unfolds.
This is how you go about making a determination.
This is sort of a summary of the national model of indications and
The national
decision
process, yes.
gotcha. Okay,
Yes.
thank you.
No, you're welcome. And not sure, Mr. Johnson or Ms. Richards, just thinking historically with the FRC, when it first came to us, it was presented to us that it would follow a national model.
Yes.
And I think it's that national model you all presented before it even went out, for Children's Home Society. That's what we voted on, was that the FRC, based on y'all's research, would follow that model. And so I think the first contract that went out to Children's Home Society also had their deliverables around this. Is that accurate?
That is.
Okay, so, all right, do we have any other questions, comments? Our next grade short presentation. All right, we'll have a Children's Home Society.
All right.
Oh, again, everyone, I will be doing a very small portion tonight. The majority of it will be done by Kim. She is our senior director. Before we get started, I want to introduce a couple of people that are here with us. We have Tara Corbell. She is our chief program officer from our state office. Thank you for coming, Tara. And this is Ernie Hamilton. He is an SVP as well from our state office. He's also my boss. So I'm really happy.
He love her.
Also, we have a number of members from the Griffin Heights Neighborhood Association. So I do want to say thank you all for coming. I am very happy that you all are here. You all have a lot of questions, which we do appreciate. So I hope that by the time we end this tonight, a lot of your questions are answered. And if they're not, I hope that we can see you later and answer those for you. All right, so again, always a pleasure coming here with you all. We really do appreciate the work that I would say we have the privilege of being able to do in our community. So the plan that you have and that we'll be walking through again was created as Executive Director Green has shared, was at the direction of the Children's Service Council. And so our goal for today is for you to hear more about the plan for Griffin Heights, Frenchtown, as well as Macon Community. However, as we're walking through the plan, we continue to reiterate, we are not doing anything for the community, but we are doing it with the community. So we want to make sure that we are also being flexible with the community and the leaders as we are working in the community to really make sure that we are moving at a pace that is working towards being collaborative in every step of the way. And I'll turn it over again.
So as we go through, I will let you know what page I'm referencing on the handout so we can follow along. I have a brief intro first, so this would be where we're just kind of passing over the executive summary. But we are excited to share our plan with you for how we hope to work with the council and communities over the next 4 months or so. Everything we do starts with the Triathic Center's community readiness model for community change, which we were just talking about. And I know that we've talked about it before, but as a reminder, I want to talk about what we mean by community readiness. This model was created by the Triathic Center at Colorado State University. It's used nationally to help communities measure how ready they are to take ownership of change. The idea here, as Tiffany said, is to build side by side with the community so that the solution we bring to you is made for them and by them. Community readiness is the degree of which a community is willing and prepared to take action for an issue. For us, the CSC has defined this issue as increasing protective factors of our community's families so that it decreases reports of child abuse and increases resilience of families here in Leon County, to specifically families with children, kids 0 to 12. Using the community readiness model ensures that these strategies match the community's level of readiness, preventing premature investments and improving sustainability. We know that it is very important to use this type of tool, use public money with the utmost discretion and chances of success. But here's the thing to think about too. When the model talks about community, they're not only talking about the residents and the parents in the zip code, but also the providers, the organizations, and community-wide efforts to organize around these issues like the council does. So back to readiness. Readiness is assessed across 6 dimensions, and that's community efforts, community knowledge of efforts, leadership, community climate, knowledge about the issues, and resources. Each dimension is scored on a 9-point anchored scale that describes what readiness looks like at each level, from no awareness to full community ownership. Each level has behavioral anchors that describe what is happening in the community at each stage. We measure using online surveys from residents and parents of the community
through focus groups of community leaders, we normalize and average scores to determine where each community falls on the continuum. The goal is not that a community be at a certain score, but the goal is that the score helps us to plan safe investments and opportunities in the community that meet where all. Sorry.
Sorry.
Pencil step.
So now that we've talked about readiness and how we measure it, let's talk about what the data shows in each of our neighborhoods. If you will turn to page 3, you will see where we begin to discuss Griffin Heights and Frenchtown area. So you'll see in the chart on page 3, there was an average readiness score of 4.36 in that pre-plan, which brings them in that pre-planning area. Strengths were that community climate is up to 5.23 and knowledge of the issues up to 5.77. An area to concentrate is on increasing leadership and resources. The community has awareness, but still needs coordination with the community and access to additional resources to move the model to the next level. So what does the model suggest that we do with this community at this stage? Well, at stages 4 and 5, actions include widening awareness, making our concrete efforts visible to the community residents, building and documenting partnerships, formalizing planning. We need to identify what partners will work with us and offer what the families have said that they need. We need to identify existing community resources and take concrete steps in the areas of leadership in ways like leadership readiness series, parent cafes, and getting additional MOUs signed for that area. For Macon, which starts on page 7, you'll see they have an average readiness of 4.22 in pre-planning. One of their strengths is community climate at a 6.8. Residents are open and trusting. Their gaps are in leadership, which is at a 2. And resources at a 3.475. Again, we're on page 7 on that little chart. And the interpretation is that high willingness, but low structural leadership. So we need to move from trust to coordinated leadership in that area. So our next step isn't to open a center immediately there, but is to build the leadership foundation first.
Mind this, where is Macon? I'm not.
Macon Town and Country, 3230.
Yeah.
Sealy School Zone.
Meridian.
Okay, all right.
It's
Out Meridian Road.
Out Meridian, it is behind, it's not Temple anymore, North Florida Christian.
Over there. Okay, go. This is that. Yeah, and that's where the fun place is. What is it?
Yes, between Fun Station and North Florida.
So through the bottom of page 7 to page 8, we outline what barrier types that we're seeing and then actionable solutions for each that include a Macon's Champion cohort of 8 to 10 community leaders, connecting with grassroots leaders and mentors, developing early MOUs to deliver concrete services via a hybrid service model, for instance, pop-ups, like when we use the FRC van, and then also scheduling at various locations to provide concrete supports, resource and referral services to the community. So now that we've looked at our 2 readiness sites, let's connect to what this means for a broader FRC plan and funding decisions. I'm going to go to page 12 where it says feasibility and sustainability. There are 3 options, CSC Leon, we hope to propose to you by May of 2026, or one of the 3. The option 1 would be a brick and mortar center for one of these locations. Option 2, mobile or hybrid model. Or option 3, pause until there's higher readiness. Each of these will include additional cost and staffing. We plan to have a preliminary budget by March Our recommendation process will align with readiness, with fiscal responsibility, so that we're investing where the community is ready to sustain. So how will we measure success and progress? You go to page 16. You will see an indicators table. And so for this, we went through and really broke down each of the efforts, where the score is now and where we would like to see the score, how we're going to indicate success in that measure, and what the data source and method is. So our efforts would be to move each targeted area to at least a 6.0, from knowing that climate may not get all the way, or no, sorry, resources might not get all the way up because of how low it is right now. We might get that to a 5.0, but overall, those are our goals. Movement between stages is the success measure, not a particular score. We can't predict exactly where any community will be, but we can and will take steps that are listed in the model as a way to promote movement in each area. So let's connect the dots between these findings and our next step as a county. On page 17D, starts to line out concrete actions and milestones that we will track through May of 2026. These steps align directly with the triadic models movement from preparation to initiation, launching visible actions and tracking results. Tiffany is going to talk a little bit about the quantitative success markers and wrap us up. But before I turn it over, I just want to say that our FRCs are building readiness, not just programs. Each stage of progress brings communities closer to owning the change themselves. And that's what sustainability and community ownership truly looks like.
So thank you, Kim. And a lot of emphasis on ownership, because at some points, we do want to make sure at every point in this process that we're doing everything with the community. Again, I have to continue to stress, we do not want to move faster than a community is actually ready or able to move. So we want to make sure that we're keeping in step with the process with all of our community members and leaders. So when we talk about readiness, what are we looking for? We're looking for, if you look at page 18 at the bottom, these are the things that we're looking for. That the perception is not this is a family resource center or this is the family resource center that belongs to CSC, but the language that we're looking for, really, and the culture that we're looking for is the community members are saying this is our FRC. Why? Because they've engaged every step of the process and they're informing the work that we're doing. Also the collaborative governance. So Executive Director Green, she mentioned about the advisory councils. The idea is that we will have leaders, residents, and also stakeholders in every community that, again, they are meeting, convening, sharing, and again, directing and guiding the work that we'll be doing. Trust signals, we talked about that before. We need the ability to demonstrate that trust is growing and developing in each community, not just exclusive to one or the other. And then finally, we need to see community members expressing interest in expanding or modeling the approach. And that's, again, consistently listening to residents, stakeholders, leaders, and them expressing what they would like to see as we continue to move forward with them. And we'll open it up for questions.
Well, thank you very much for that presentation. And we will engage in discussion. I'm curious, do you guys, for a comparison, have, I'm looking at Holly because I'm not sure you might have it, for Fort Braden, a comparison of what their readiness assessment numbers look like?
Yes, we've submitted that for our last presentation. Carly, are you able to pull that up? Yes.
Why did I pull that up? I see Mr. Mitchell.
I got. I have a lot of questions. Bear with me. Let me go back to the very, not the very beginning, but council meeting where we decided to fund the family resource centers that are currently up and operational, and then staffing for other areas. The council funded the FRC here. Council funded the FRC at Fort Braden. And then how many additional, and I forget what they were called, but where you've got, someone in Macon, you've got someone in Frenchtown and Griffin
Correct.
Heights?
There's, yes,
Two?
two. We've said, Frenchtown Griffin Heights has Miss Ashley.
So you do both, actually? Okay,
And then Macon Town and Country is Miss Michelle.
very nice. So we have two in addition that are full-time folks in those communities trying to raise awareness and get them to the point of readiness.
Correct.
Okay, that the first question. Tiffany, I heard you welcome the folks from Griffin Heights. I recognize, I think, every face there. Is there anyone here from Macon?
Not today.
Is that telling?
Yeah, and if you look at the scores for Bacon versus Griffin Heights, you'll see where they scored lower in that leadership area, which is also why some of our very first plans for that area are to further engage the leadership there.
Very good. Got your work cut out for you. Kim, in your presentation, you talked, well, first, Tiffany, in your presentation, you talked about the fact that we have a goal. That what we told you is we want this national model. And what we would like is to implement it in these areas. And from that implementation, we want to see an effect. And that effect is reduction of harm in children with
Child maltreatment.
exactly what I said.
That's what I heard.
Yes. I move my mouth, the words come out. So that's our goal, okay? So that is, by the way, a lot. As we were gathering information from the different communities, we asked them, what resources do you need? Did they understand that those resources, I hate the word, first of all, I hate the title Family Resource Center because it sounds like a place you can go to get resources, like a physical resource. But did we match what the community said they needed in terms of resources with the effect that would have on what our goal is? And that is exactly what Sika said that I repeated verbatim.
So that is how our programming is currently working at Cross Creek and at Fort Braden.
Right.
In the other areas, we have started to and have through that survey process identified what those areas are. Frenchtown, Griffin Heights, for example, the top three that came up were safety or crime concerns, food insecurity, and childcare. So now within that, where are the families and what programs need to target the families in those concerns that have been identified? So that's part of our next step within these listening sessions that's outlined in the plan, is to find out what services within those scopes that we've identified will parents, not only do they need, but will they participate fully in? And those really have to be for the community, by the community, rather than us going in and saying, here's what you said we need, this is what it's gonna look like, please show up every day and take use of it. So I think there's a little separation there of how that's supposed to look.
For the just for the courtesy of my other council members, I'm gonna ask one more question, and then if there's still time, Mr. Chair, I'll follow back up, but this national model that we have begun to implement that has been successful in communities all across the country, including one just down in Alachua County, that's just taking fun now. Do not say many nice things about Alachua County, so let the record show. Not only did they beat us basketball last night, they hate that place. Come on.
Not Penny Riley on.
I tip my hat to them. I do. Have any of the national models utilized the mobile unit approach?
Yes. Absolutely. And at the last national convening, that was a huge part of the conference was this movement towards mobile models, especially for outlying areas, rural areas. They had several presentations on it and are starting now to just how they have standards for an actual center. And I sit on the planning committee for this. They are working out what their standards look like for a mobile unit.
It's following up on the mobile units. It's still the same line of questioning, so I'm keeping to my word. It is part of that, the standard of practice that you guys are considering same day in the community, like we'll say community A, we're here Monday, Thursday, and Saturday from 8 to 12, same day, same time, same back channel, always.
Right, so that is a portion of it, is that co-located service where we are identifying those anchor organizations that we can convene services at. That's part of it. The other part, as we have the vans already, is still utilizing them depending on the area. For example, in Fort Braden, they have where they deliver frozen chicken on Fridays to some parents who can't make it there to pick up. Ashley has utilized the van to do care essential drop-offs in certain neighborhoods, and also for that visibility at community events. But for right now, what we're talking about is the use of the current vans that we have. And then towards March, looking at these options of, is it a brick and mortar that's feasible? Do we want to go harder on the mobile unit side, or is neither community ready for either one? Or are we not ready with the community for either one? So those would be the three options that we'd be looking to bring back by the end of the year.
I'm interrupting.
Yes.
I don't know. I want to make sure I understood your question, which I thought is a part of when contemplating the quality standards for mobile units, is a part of that scheduled visits in particular neighborhoods at times when the community knows they will always be.
Yes.
Yes.
That's,
Yes.
okay, I didn't hear that.
Yes,
answer.
that is a bold part of it, but will not only be limited to that. They'll do other things as well. Show up at community events and things like that. But yes, having that sustained scheduling where the community can rely, I know on this day, this is where I need to be in order to get this service. And getting the word out there and making connection with the community so that they know that that's happening.
Ms. Richards?
This question is for Director Green. Do you have a map of services within within the zip codes? So what we're funding within each zip code? Which makes sense.
I think I know that.
Or does this have to be a map? It could
Do
just
we
be
have a
zip
heat
code.
map that shows the programs that we fund and the zip codes where they are funded?
Yes.
Holly is working on that,
Okay.
but we do not have that at hand.
It's perfect, usual.
This makes sense. The question from Councilmember Richards was, do we have a heat map that shows everywhere programs exist that we have funded currently currently mostly, but in the past as well. And my response was, we are working on that strategically. Yes.
Yeah, if we could get both, we could get what we have funded in the past, but like probably more importantly, what is currently
It's currently
funded
being funded.
and continuously funded. That would be great.
Yes. Thank you, Mr. Vice Chair. And thank you guys, for your presentation, your projection over the next 6 months. But I want to follow up with, Councilmember Mitchell's question about the mobile units. How many mobile units do we have now? Do you have now?
So we do not have a technical
You don't have.
full mobile unit. We
Okay.
have 2 vans that are wrapped. And one is located at Fort Braden and one is home-based here. And the one that is home-based here, both Ashley and Michelle use for their outward community work. And so it's kind of shared between the different
Okay, so
areas.
The vans rented, they
Leased.
rented, through the home society?
Correct.
Okay.
Through the,
But
funded through the
it's
contract.
Funded through the contract.
Correct.
How much do we spend annually on those vans, do you?
I'm gonna interject if I may, Dina. Are you able to pull up what is expended on the van,
On the vans.
on the vans from CHA?
Oh, okay, but they're I said rented, leased, right?
Yes.
Lease. Okay, and so the maintenance and everything is part of the lease that
Correct.
you all have to pay for,
Correct.
the gas and everything?
Yes.
Okay. Do you, how are the people, I know you said one is stationary in Fort Bragg and the other in other communities?
Yeah, each is fiscally billed to one of the centers. So one is under the Fort Braden budget, one is over the Cross Creek budget. All outreach falls under the Cross Creek budget. So both Michelle and Ashley fall under this center's budget as the pilot, because that's what originally had the outreach.
Oh, okay, but you all have indicated that we got these numbers about readiness and non-readiness in these neighborhoods. And is that measured by you all going to the neighborhoods? For meetings of, schedule for the vans going, for your people talking to?
Yes.
Okay, what is, do you know just generally what the schedule is, or how do we disseminate that schedule to the residents in those communities? How do they know?
So Ashley and Michelle each have their number of email address contacts that they go through, and they create flyers to let the community know that they're coming and when they'll be. And again, it's working on that, making sure that we're in the same places the same day so that can be consistent. And we actively started with that process October 1st
Okay, and just.
with as far as the vans and particularly day scheduling.
Okay, so we've got outreach steps. So other than the flyer saying we'll be here, what are we providing anything in those communities?
So we
Or what do we anticipate?
right.
What are we providing anything, or what do we anticipate could be provided with mobile units in those communities as opposed to brick and mortar?
Right, so for right now, we are, if you go to page. Six. That kind of, spaces out or, line items out the actual activities between November and May as far as listening circles, they use storyboard boards to map desired services, co-design labs, and reviewing high access sites. So it's kind of broken down step by step of what we need to do in each area.
Oh, no, okay, I understand, but that's not my question. My
Oh,
question was, are we providing any services through the mobile unit similar to what we're doing here and what we're doing in Fort Bragg? Or is that
So-
something that we would
That's,
anticipate?
we do not have funds outlined in our current budget to provide navigation or other skills for that outreach areas. Each outreach area has a small budget of things for their flyers, for their printing, food for meetings, things like that.
Okay.
So what our ask would be later on when we come back is what that looks like to either do a more intensified mobile unit with actual services there. But we do intend to, in this meantime, when we're looking at organizations to co-locate with and to kind of bring together, is making sure that those services can get out there or they're connected to. For example, with Whole Child Leon, we're currently working with them. They have days at each center, but there is times that we can go ahead and use them for those outreach areas in between, so that we will start to get those MOUs in place to start to see services so that we can start to help people. But right now, that's not currently how the budget was set up.
And that makes sense too, and I appreciate that, because nobody's really allocated for those communities just yet. You all are just, I guess, just going there, getting a feel for the community member. And then one last question, Mr.
This whole meeting, this workshop is for.
Okay, you talked about the national models and national models as far as mobile unit services. And you also said that the trend is that they're primarily utilized in the rural areas.
That's what's been reported so far on
Okay.
the national level, yes.
Oh, okay. Given, and I know you guys are familiar with the demographics in these three communities that we're talking about, we don't have, do we have any information or statistics on how effective mobile units are in areas with the demographics of the communities that we're looking at?
So there are currently some studies going on right now that they are going to be pulling from and to inform the mobile unit.
Okay.
And specifically in areas where there's prevalence of gang violence or territory issues. And so those studies are not complete and have not been fully published yet. But as they are, we can definitely provide some of that information, and we'll rely on that to inform what we continue to do.
Awesome. Okay, thank you. Thank you, Mr. Vice Chair.
Thank you. These may be terrible questions, but Commissioner Cummings opened a big can of worms for me, and I just want to make sure I understand a process of, what are the titles of the positions right now?
Family and Community Engagement Coordinator.
Family and Community Engagement Coordinators. Okay, so to the budget example you just provided. So right now in the budget are those positions are charged with, I'm gonna use this phrase lightly, but a needs assessment to determine, right, bring back to us the readiness of a community for FRC. That's what's.
So I wouldn't say the word.
Not needs assessment, but a readiness. So that's it.
The aptitude of the community to engage with and inform on and participate in the process. The readiness of that community to take ownership of the problem and participate in that solution.
Okay.
That's what we're looking for.
So I'm envisioning those positions as, I don't know, there's like documented, these are not trick questions, I'm trying to understand the process.
Mhm.
We have documented efforts, like
Right.
this is like, these are our actions to assess this, what we rated on, like, these are just not numbers that came out of somewhere. How did they capture that? Like, where is that information? Are there like a report they're submitting, like, I'm like seeing like an action plan, or like, what is, okay.
Yeah, we submit a monthly report on numbers and then quarterly narrative on all of the activities that have been going on.
Okay.
And so from the beginning, we've had those reports from both areas that we turn in on what the action items were. There was a period of time where that slowed down a little bit because of staffing issues that we had here at Cross Creek, where we did pull the face positions back in and use them to help with coverage a little bit. And the outreach didn't stop, but it did lessen kind of for, I guess, a month and a half or so. But yeah, we turn that in each time. What we're looking to do is, previously we didn't have strict outcomes like this tied to those outreach areas. That's another reason why for this plan, we wanted to tie that in, so that as we're looking at this contract, and thank you for agreeing to fund it, at the last meeting, but what outcomes need to be put in there within an amendment set that really will capture what we're doing in those outlying areas so that you guys can kind of see the proof in the pudding.
In those reports, as you say, that are being turned in, that's being turned into CSC staff.
Correct.
So then maybe this is for CSC staff. So then y'all, who on the team evaluates? So let's go with Griffin Height. Oh, no, not, let's go with Macon. Sorry, not Griffin Height. I didn't hear, but using Macon. Like one of the reports like said they don't have leadership. It's like a 2 score or something like that. So the deliverables, they are like, this is what we did in Macon from this last whatever period of time. These are our actions we tried to engage in to raise blah, blah, blah. And someone from CSC evaluates that and
So we have a lead performance partner, and actually the FRCs are under the lead performance partner, and then Dina works alongside with them. What I will say in all transparency, under the first contract, while we knew they were doing this work, we did not have it delineated on how that is reported. So the reports were coming in monthly, and then you had the activities, but there wasn't a detail of. So if the activity was
Wasn't tied to.
we're going to neighborhood association meetings. We didn't have it tied where it said you did 3, you did 4, you did them on this date. That is what she's saying. We are delineating that in the new amendment so that there is a clear definition of the actual outreach activity, when it happened, that type of thing. So of course, this was new for everyone. It was new for us. And when we went into this amendment, we realized we need to be able to have that information as well.
so maybe 2 more not trick questions.
Sure.
So Griffin Heights, okay, the numbers that we saw that was in here today, what is the period of how that was assessed?
So that was during the assessment time. The assessment time ran last year through May, when we turned in our report then in June. So that's now activities and outreach activities continued, but surveys stopped in May because we had to have a cutoff date so that we could analyze the data and get it to you by that June report. And so from there, we went into providing outreach more so than the surveys. And there's also been a little bit of survey fatigue. So we are trying to make sure that those, that we're getting the data in a different kind of way by doing listening sessions.
So do we feel, maybe the staff or whatnot, or just CHS, that those numbers are just saying not being, are they accurate? Is that fair? If we didn't follow the new amendment that we're articulating, we're gonna go to. So now the question answer could be yes. Do we feel like that period, that information is valid to support Griffin Heights numbers?
I would say yes, because in all of the other areas, they were held to the same standard when we did their surveys without having these objectives for each of those areas as well. So they each started with that same FTE of person required to collect the same amount of surveys. So for the period of time that we took it for the work that we did, I do believe that they are accurate. We have done additional outreach. And as we've seen, just by having people show up here today, obviously awareness is there. And now it's starting to get that traction. So it is a process. I would say those numbers are definitely accurate for the time, but at this time, it's more important to build that rapport and engage through a plan than it is to do those surveys again, if that makes sense. Because through the surveys, they've identified what their biggest needs are. Now it's how do we get to the next step?
So Vice Chair Watts, their work is, data was the first part of that. After we finished the data part, one part was being able to integrate into the community. So historically, CHS has done case management work in some of our communities. The work that we're doing now is very different than what we did before. So a part of being present in those communities is really sharing who we are now, because that's very different from the services we provided before. But we also need to be able to establish those relationships for the purpose of collaboration. So it's an integration part, It's a collaboration part and really cultivating relationships while we're present in the community. And we've recognized that that takes a little bit more time depending on what community we're in.
Thank you. So I've sat through a lot of meetings and I've gone to a lot of meetings, and I think it's accurate to say there is survey fatigue. And not just the amount of surveys that are provided, but you asked me my opinion, I gave it to you, and then you didn't do anything with it. Fatigue, whatever you want to put that is as a category. Those are the two things that I've heard a lot. So yeah, I'm not saying don't ever do another survey. Probably it's appropriate at some point, but I like the idea of listening to the community, going to the community and listening. I will say that each time I don't define a community as, 15 or 20 people. I think those are 15 or 20 very dedicated people who believe in, like, they want something to happen, and I don't blame them. But that's what I see. I'm just being incredibly candid. The community is the community. And I think it would speak volumes to me between now and whenever we're going to make this decision to see just how interested the full community is. And that maybe we need to have a community meeting where we invite the community to come in and all of the council members are invited.
Those types of meetings are included as action steps within the plan.
Sure, thank you.
The difference though is we have recognized the same thing you've just shared. The difference is with this draft, I'm gonna call it a draft because it may change based on how things are moving forward. We are going to concentrate on utilizing members of the community to help us identify parents. We've learned that parents are not engaged. They are not significantly engaged in that community. We know that from going to the community center. We know that from talking to different pastors. We know that from going to different schools in the community, because every aspect, all of them have said the same thing. Parents, it is difficult to get parents engaged. And if you do get them engaged, they may not consistently be engaged. So we recognize that and identify that. So having multiple listening sessions, our goal and aim is to accomplish exactly what you said, to get a broader number and really sit down and listen to parents and families.
So as it relates to communities, we are today focusing in on two communities. It's not fair to lump Frenchtown and Griffin Heights together, but proximity wise, they're very, right? They abut each other. When we were doing we took our needs assessment from almost 5 years ago, 4 years ago, and we laid it on top of Leon County. So there are other communities in this county that are not served at all by the Children's Services Council, or very little. I think of places like Woodville. I think of places like, I'm gonna call it Fred George Road, but you know what I'm talking about, like
Jackson.
north of, thank you, north of I-10. That are underserved, Lake Jackson, thank you. When we're evaluating where to go next, are we not evaluating because their numbers are so much lower than Griffin Heights and Frenchtown and Macon?
Partially, yes. If you were around when we did our initial proposal and through that entire negotiation process. So we did exactly what you mentioned. We took that original assessment data that was completed through the Children's Service Council, And that's exactly what I did. I got a map of Leon County and I looked at the map and I actually drew circles on that map based on the data that we were provided from Children's Service Council. So the most need, the concentrated areas, that is how we identified our initially proposed sites. And based on the infant mortality rates, based on, I think it was the reading level rates, Griffin Heights, Frenchtown actually had the highest numbers. So that was one of the areas that we actually prioritized because of the data that we were providing. So through this process, we've continued to maintain those 4 original communities because that is where the data said that we really needed to be.
That's also where we were funded for the contract. So if we were to explore additional areas, then that would be additional.
So, but, and I'm heading in a slightly different direction. But before I leave these 2 communities, you talked about that I see a mobile unit very different, Lee, than I do the 2 Toyota Siennas, right? The minivans. Those are mobile, I'll give you that, but I see a mobile unit as being a little more substantial. And maybe that's just my visual.
When we talk about of the 3 options, the first 2, one being a brick and mortar and the other being a mobile hybrid, that would include a more robust what people think of when they think of mobile unit.
Right.
But right now, what we're presenting is what our plan is through our current contract dollars for those outlying areas that have been identified.
So, Kim, you talked about Whole Child Leon and your partnership. They're doing the screenings, they're doing the hearing, the visual, the mental health screenings, right? That is all going on with the minivan mobile units into Griffin Heights, Frenchtown, and Macon.
Right now, that is happening at both centers. We are proposing for this, now that we've started in this new year, to start doing those in those 2 identified areas as well, so that we can move from doing surveys to providing some kind of substance service.
And then, again, before we leave these 2 communities, you mentioned in Fort Braden, I know about the frozen chickens and Share Our Heart, their efforts there, in getting out to folks who can't get to the center, just to make sure that they have nourishment. And you mentioned, I can't remember, Tiffany or Kim, which one of you talked about personal items in
Hygiene packages.
thank you, hygiene packages. Clearly, this is not my vocabulary.
You get there.
Yes, it's only been 5 years, right? Those are being delivered by the minivans in Griffin Heights, Frenchtown, and Macon currently.
They have been, but we need to define a consistent location to do that. We've done several projects where we've had days that we've done it, but now we're trying to move to specific, reliable program.
Very good. Grow, learn. I think that's terrific. Now, bear with me for just one more line of questioning, and this is now back to the mobile units. If you were to go back and look at the proposal you all submitted, that I set up both the evaluation and the negotiation, you were to look at the communities in Leon County, the areas of intense need, you mentioned Griffin Heights and Frenchtown being, sort of spiky. If you couple that with numbers of kids in those areas, and then you say to yourself, we have an incredibly limited budget. And if I'm a parent in Griffin Heights and someone says to me, you can spend a whole bunch of money on a physical building where people can come and if service providers want to gather there. Or we can make sure that after school services are provided to kids where they get nourishment, where they are taught how to learn at the third grade level by the time they're in third grade. There are summer camps provided. As a parent, I'm thinking to myself, hey, I like those. And if if there are 2 days a week, I knew that there was a mobile unit, significant mobile unit where we brought services, needed services to the community that they were continuing to tell us, hey, you know what? This is all great, but here's what we're missing. And then we continued to monitor and we continued to reevaluate. And we could extend that to the other communities. Maybe we spend more days where the spikes occurred in Griffin Heights and Frenchtown, but places like Lake Jackson, places like Woodville were also being served. Again, I think about how large Leon County is and how many communities of need there are. And look, I live close to downtown, so those Macon and Griffin Heights, I think of them because I'm sort of part of that, overall community, but Chairs and Woodville, and I just don't want to forget them. And the mobile unit to me, again, as long as it's consistent with the national standards, as long as it's substantial, as long as it's consistently there and providing services, that's where again, limited resources, that's where my brain is heading. And oh, by the way, in our budget, we are funding a position in Griffin Heights and Frenchtown and a van. It may fall under the budget for this center here, but Ashley's in Frenchtown and Griffin Heights. And
Michelle and Megan, so they kind of split the name.
okay, right. Okay. That's it. Thank you.
Well, thank you, and I'll make sure some of that is on your poo-poo platter option when we come back.
Thank you, Mr. Chair, just real fast. But first of all, the hygiene packets, where do they come from? They're not out of your budget, right?
No, the products were initially donated by ViStar Credit Union.
Oh, okay.
And then we have been re-upped by the commission, Oasis, Ashley.
Yes, ma'am.
Okay.
Oh, okay, awesome. You mentioned, you've got enough surveys from last year through May of this year.
To inform that part of the process.
Oh, no, I
yes.
understand. No, I'm trying to determine the period of time that the surveys were collected. Was it a year, 6 months?
Well, we did it, the first contract, we survey collected for 6 months. The second one was about 6 months worth of time with survey collection.
Okay, so you went to the various communities that we just talked about.
Yes.
Including, I guess, here.
Door to door,
Cross
the
Creek, Fort
schools
Brady.
showing up at the community parks during soccer and little league games. Trying to get parents while they were there. Yeah.
Oh, okay, well, I commend you guys for doing that. I also commend you guys for zeroing in on those specific areas where our needs assessment said are in the greatest need. And I agree with Councilman Mitchell that it's needs all over the county. But under the statute, we couldn't spend 1 penny until we had a professional needs assessment done in our county. And the areas that you all have concentrated on were clearly the areas of most need. Now, I don't have a problem with outreaching to other areas. The communities that Councilmember Mitchell mentioned clearly, there is a need. But I think where we are, where we're looking right now, has heightened the, and I commend you guys for recognizing that. But now my other point is this. We have our annual well, not annual, our report from the Children's Services Council that was issued within the last, month or so. And I think we have great numbers about the success of the Children's Services Council so far. In the meantime, we have also had wide coverage of the success of the Family Resource Center here, the Family Resource Center in Fort Braden. There's news coverage, television, media coverage. And the notion is that the Family Resource Center here is a game changer for the families. The Family Resource Center in Fort Braden has been a game changer for the families, and those are brick and mortar. They are not mobile units. So clearly, my preference as a council member is to mimic that. I want the communities that we're talking about to have a family resource center that's a game changer for those families and for those parents. And these game changers that we are lauding and we applaud you guys for are brick and mortar. And that's what I would prefer that we aspire to achieve for those families in those communities. Now, we've had some family members come and give us anecdotal information here in our meetings about how great this center is. We've seen, and we know that in Fort Braden, there are other resources. Talk about food and food pantry, and I think we saw a diaper pantry in different items. I think we can replicate that and more in these communities that you all are concentrating on right now. And so my preference would be, and I commend you guys, and I would just invite you to continue what you're doing in those communities, and I think with the help of members of the Children's Services Council, we will arrive and we will have the documentation and the involvement from the community members to sustain a family resource center and to have the input from families and the communities and the churches and the pastors. And like the other two, I think it would clearly be a game changer for the citizens in those areas. So I just thank you guys. Absolutely.
All right, we have any other comments from council members, questions? Thank you very much for your presentation tonight. We really appreciate it. And that's gonna bring us to our next agenda item, which is member comments. So in general, does anyone have anything that they would like to share and or add? Comments?
I'll make one bit of comment, Terry. Family Resource Center does not provide resources. We don't provide resources. In the case of Fort Braden, which if you've driven to Fort Braden, if you want to count the filling station that has a convenience store at the corner of Capitol Circle and Highway 20 and drive out, it's a desert resources. There is nothing. What fills the resource center is nothing from the family or from the Children's Services Council. What fills it is the community itself. The community that scored high on the national model because they wanted anything. I so commend Fort Braden, the community, for rallying around each other. Those in need were surrounded by those who didn't have needs. And that's what makes Fort Braden's Family Resource Center successful. The county, I think, was incredibly generous in providing a small, I'll call it 1.5 room schoolhouse that is the Family Resource Center. So that's the brick and mortar. If I have no doubt that there's a brick and mortar in Fort Griffin, in Macon, in Fred George Lake Jackson, Woodville, I have no doubt. But until the community is ready to put the resources in, it's an empty building. It is not build it and they will come. So my comments earlier about going to meetings and it's the same 20 people. Look, I'm talking to all of you right here. I applaud you. You guys are gonna make the difference for that community. Now it's, I think, incumbent upon you to go, each of you, find another 20 or 30 people to show up at a meeting and say, this is what we need. By the way, just because you have a need doesn't mean it meets our goal. As long as the need meets our goal, and certainly, there's no doubt that the need for resources will meet our goals. We gotta hear from them. You know, I look at Ms. Mitchell in the back, my sister from another mystery, and I think to myself, that's a lady who's dedicated to her community. I know you're here speaking for 20 or 30 other bodies. I know that. But what will make this a success? Whether it's a unit or a physical unit, what's gonna make whatever becomes of a center, an area where the community can gather, it's the community itself. If we start by having a mobile unit and it raises the awareness and it gets the community involved and it is the spark that's needed, and that turns into a brick and mortar, great. And then that mobile unit can go spend more time in Woodville and more time in chairs and more time in other communities until it's ready to pop up with a brick and mortar. I just want to make sure that everyone understands that just by having a building that's designated with the sign that says Family Resource Center, it is neither a center, nor does it have resources, nor is it serving families until the people in that community are ready to do it. That's where I make my vote. It will be based on those things. And with that, Mr. Chair, I thank you for letting get that off my chest.
Here,
Yes.
and I was gonna hold this, but I'd like to say this now, as far as research goes to in the communities. I have been in touch with organizations, churches, authorities, public service organizations in this city that are willing to contribute to a family resource center in those communities. For example, one entity would consider manning a pamper pantry for Pampers, donating those themselves. Another organization, this one that I'm involved with, we have adopted various public service interests in many of our nonprofit organizations where we contribute. Say, for instance, let me give an example. One of our nonprofits provides services and overnight services for battered women and children. And we have at one point taken upon ourselves to just contribute underwear for children, underwear for socks, underwear for women, adults, donated it. Okay, but it's there, it would be there at the resource center for individuals in that community to utilize. There are sororities and fraternities in the community that donate food for food pantries at various nonprofits in the community. There are churches, as a matter of fact, my church has adopted one of the centers, one of the Head Start centers. And we have donated money, we have donated food for that Head Start center. So my vision, and this is why I have talked to different entities in this community, because the entities that I'm talking about have memberships of 50 to 100 or more individuals. And it only takes, say, for instance, the diaper pantry. One member bringing a pack of diapers. So if you got 50 members or 100 members, you have got a solid pantry for those mothers that need that type service for a month or two. So we all have to work together. And I don't believe that the members in the community envision a family resource center as providing the resources from the Children's Services Council. But we envision a partnership with groups, with churches, with businesses in that community who will also donate resources. And I think in doing so, we will see that we will have a game changer, just like we have here, just like we have in Fort Brady. So it would be a collaborative effort, Mr. Mitchell. It wouldn't come from Children's Services Council funds. But I know of organizations that are willing to contribute to that center if it's established and once it's established in the community. So in that sense, we would have cooperation, partnership, collaboration, and I think it would work. But they can't contribute until it's established. You know, it's got to be established before. But I think we'll see all sorts of resources piling in based on what the community tells us their needs are. Thank you, Mr. Chair.
Thank you. We appreciate all of those comments, and you know, I tie it back to Children's Home Society. This is, I think, what pushed you all over the finish line to be the FRC provider, was that you all could form those partnerships. Those sound like, you know, Commissioner Cummings is already, you know, maybe working on the job with you all. Yeah, so it is twofold. I put it back on Children's Home Society. It was community, but then also the partnerships. So it is collaborative and it's on both ends. Look at it.
I will say, Commissioner Cummings, thank you. We do not need a building for what you just shared to happen. If somebody wants to donate diapers or whatever else to help support that community, we will gladly accept that. A building is not necessary for us to start the work. And that's what we're trying to continue to reiterate. A building will not stop those types of things from happening. And I'm saying this for everybody in the room. If you know a group that is willing to work and collaborate with us, we would love to do that. And please give them our email, phone number, so we can get that started.
Appreciate that.
Yeah.
So as we close the workshop out, council members, first of all, thank you for being here. Chair Jones did say he was in a meeting with the county administrator, so he was not able to get away, but wanted to. That's his fault. But wanted to thank you all for being here. So the purpose of the workshop was threefold: to give you confidence in the process of how CHS is moving forward, comfort with the timeline that they developed, which they presented here, and then an understanding on how the community engagement indicators inform a recommendation, an investment recommendation. So our hope as a staff and in partnership with CHS is that these three things were accomplished through this workshop. I also want to take this opportunity to remind you that we have executive committee meeting on December 10th. We have Finance and Budget Committee meeting on December 10th. And our next full council meeting is Thursday, December 18th. We also have a new council member that will be joining us in December. Ms. Austin Linden, and we are getting her orientation scheduled, getting her picture to put up, and going to be bringing her up to speed on all of this wonderfulness that has been going on.
Thank you. So we don't have to have a vote.
Oh, I have just one question. Holly, as our procurement officer, dates for the RFQ to come back? What, is it the 21st that they're due by?
21st, they're due.
They're due by, and then you will evaluate those that qualify will go to the finance committee?
Not evaluate,
No, I'm sorry,
review.
review for qualifications to make sure that they meet the specific
Baseline.
provisions of.
Is that November, December?
November.
November
November
21st. Then, so that will take hopefully not long. Then the finance committee will get them and we will evaluate them openly with each other on the 10th.
Yes.
As part of that meeting and decide whether or not we're gonna make a recommendation or just bring our thoughts forward to the full meeting on the 18th.
Yes.
Thank you.
All right, anything else? Well, thank you. This meeting is adjourned at 5:05.
Grant.